When you're scheduled to have a colonoscopy at Phoenix Children's, there's a couple of steps that you need to take to be fully ready for the procedure. I'm Dr. Paul Tran. I'm a pediatric gastroenterologist here at Phoenix Children's. Here we do everything we can to make sure that your procedure is a success and to support you every step of the way. Let's talk a little bit about it. Colonoscopy is a method that doctors use to pinpoint issues in the colon or the large intestine. During the colonoscopy procedure, we use a flexible tube with a camera at the end called an endoscope or colonoscope to see the inside of the colon or the large intestine. To clearly see the walls of the colon, all traces of food, waste, really poo, need to be flushed out. 1 week before the colonoscopy, you'll need to avoid certain medications. If you need to take a medicine to lower a fever or for pain, it's okay to take a medicine like acetaminophen. 3 days before the procedure, avoid red meat and sauces. Any foods really with red, blue, or purple color. We don't want to see this and mistake these foods for blood in the colon. Also, certain foods with high fiber, like raw vegetables, nuts, and popcorn, tend to take longer to pass through the colon, so we generally say to avoid these. The day before the procedure, no solid food is allowed. We ask that you drink clear liquids only. Clears can include flavored, sparkling, or plain water, as well as clear fruit juices without pulp, clear chicken broth, electrolyte drinks like Pedialyte or Gatorade, Jell-O with no toppings, or popsicles. Please remember to avoid any of these foods or drinks with red, blue, or purple color. A nurse will call you with specific directions for starting liquids and very clear instructions for when and how to take laxatives. The type of laxative and dosage varies based on your size and age. This is the most challenging part of getting your body ready for a colonoscopy. Let's dig into that. Think of your colon as a pipe that is clogged with bits of food your body doesn't want. Laxatives help soften the stool and give bowels the urge to move again, and again, and again, until the stool is watery and clear. During the preparation time, we ask that you stay close to a bathroom and drink plenty of clear fluids to stay hydrated. It's a good idea to keep extra soft toilet tissue or flushable wipes on hand to soothe any irritation. If nausea or vomiting occurs, space out the doses of laxatives throughout the day. I think about it like a clogged toilet. If you keep flushing it, it's going to eventually overflow. Give it time to settle out. Patients are allowed clear liquids up to 2 hours before the procedure. Be sure to follow all directions given to you by your GI doctor and nurse team. When you arrive at Phoenix Children's for your procedure, a nurse will check your vitals and give you a medical gown to change into. Your GI doctor will speak to you and your parent or guardian, and an anesthesiologist will insert an IV into your arm to give you a medicine that will help you fall asleep. When the procedure is done, you'll be taken to the recovery area. You may feel tired, groggy, and not yourself as the anesthesia wears off. The doctor will meet with your parent or guardian to show them the images from the procedure and give updates on any findings. However, full test results are usually available within the first 2 weeks after the procedure. Next, parents are taken to the recovery area. Once you are awake, alert, and feeling yourself again, your family can take you home. As a patient, you should wait until you get home before eating a light meal. Medicine during the colonoscopy procedure may cause dizziness and make it easier to get carsick. We ask that you not schedule any physical activities on the day of your colonoscopy. It's best to stay home and relax for the rest of the day. If you have any questions about the procedure, contact your GI doc. You can also find helpful information on Phoenix Children's website in the Gastroenterology and GI Surgery section. Preparing for a colonoscopy isn't exactly the easiest step. It's honestly the hardest part of the procedure, but it's necessary in order to have a successful procedure with a clear view of the colon. Please keep in mind that our highly trained doctors, nurses, and staff will support you and your family every step of the way.